Well, watch out for it. Thank you, Nikki D.
Thank you.
According to the American Public Health Association, medical debt is a leading cause of bankruptcy in the United States. Medical bills can be frustrating, but there are ways to potentially negotiate a costly bill. Here to share more is local CPA Phil Umansky, and we welcome him back to Virginia this morning. Always good to see you, sir.
Good to be here, Bill.
This is something that is so mind-boggling to most of us. You know, you go to the hospital for whatever, and then you get the bill, and it's like a small book, and you're paging through it, and an ibuprofen costs $26.50, and you look at that and you go, what's going on here?
Absolutely.
Yeah. So there are ways that you can kind of bring this somewhat back to reality.
Well, the reality is the bill.
Yeah.
You know, it's interesting. You got the patient involved, you got the doctor, and you got the insurance company, and then you also have the government.
Yeah.
So all of this can be very, very not understandable at times.
Yeah.
But just like any purchase decision, what you got to think about is I'm going to get a bill and I'm going to pay it. So the most important thing is to look at the bill.
Yeah, and you're not able to shop around in advance in a lot of cases too and get the best deal, or you pretty much go where you have to go.
Yeah, you've got to go to the hospital or the doctor that's in your network.
Yeah.
But there's some interesting things. You talked about that the American, I guess one of those professional associations. So first of all, ask for an itemized bill. Some people will just get a bill and they have no idea what it's for.
Sure.
But if you ask for an itemized bill, then you're going to be able to detail the different services and treatments and I'll call materials that go into your health issue. So by asking for that, you can identify some big ticket items. For example, if you go to the hospital and you have an MRI and they have it down as a CT scan, that can be quite different in terms of the cost.
Yeah.
Absolutely.
One of the things I was reading through your notes that you had for us is that one lady saved $500 off her bill by offering to pay up front. I mean, most of us probably can't afford to do that, but that was a $5,000 bill.
Well,
and all she did was ask.
Well, it's interesting because we go for medical tests. As you get, when you get up to 63 or 64.
Yeah.
So we've gone to doctors where they do expect a payment up front.
Yeah.
But a lot of times what they'll say is if you can pay the whole thing, you can have a significant savings. Okay, I've got a test tomorrow, a CT scan, so I'm probably going to have to make some payment. The other thing that's interesting is when you make a payment and they ask, all right, the MRI is going to be $800. Well, can I spread it out over maybe 3 or 4 months? And a lot of times they're more than willing to do that. So it's a matter of just sort of like any other purchase, negotiating. Remember, medical institutions want money. They don't want you not to pay, so they're going to be very accommodating as far as any type of payment situation where you're being proactive.
It don't hurt to ask.
It never hurts.
Yeah.
It never hurts to ask.
Yeah. So you ask, and if you obviously you can't pay the whole thing in a lump sum. Most of us don't have that kind of money. But if you could and you can save money, then go for it, I guess. But the other thing is you can negotiate that out over a period of time because bottom line, literally bottom line, they want that money. And if they have to get it broken down into payments, they will.
Absolutely. Now there's something else that's very interesting. You would expect with all the computers that they have in hospitals that there wouldn't be any errors. It may be a big bill, but you wouldn't expect there to be any errors. Yeah. Well, there are significant errors. Let me give you some information.
Okay.
It says between 50 and 80% of medical bills contain errors according to medical billing experts. And you can guess that none of these errors work out in
your favor. Yeah.
So once you spot an error, obviously you want the error corrected. In most cases, it's going to lower your bill. It's just a matter of saying, hey, I don't think I had this. This is an error. It could be a coding error. Somebody, on a computer coding. I mean, I don't want to accuse anybody of doing anything unethical, but it does sort of seem that it's strange that it's always
50 to 80%. It's always in their favor.
Yeah. I mean, 80%, 50%. You could think, all right, that's half in their favor, half in our favor.
So let me ask you a question. So you go to the hospital, you have a procedure done, you come home, the bill comes. Do we call our CPA and say, can you come by the house real quick for a minute or two? Or do I need to come to the office? Because it's that complicated in some ways, isn't it?
In many cases, it's complicated. Now, let me give you another clue. And that is the price that you see for a service is not typically the price that the insurance company is going to negotiate. So why should it be the price that you have to negotiate if you don't have insurance? So you could actually go and negotiate prices. A lot of medical facilities now have transparency in pricing, and you can actually go to a website and see what the cost of a procedure is. But a lot of times the cost of the procedure is a Cadillac price, the price that they would give somebody uninsured. Is not the price that they're going to give the insurance company. So you'll be able to use that as a basis for negotiation.
All right. You know, it's so complicated. I think I'm just going to call you every time I have a procedure. If you'd like some more information on the topic, we'll post a link on our show website by early this afternoon, WTVR.com/VTM. Jessica, I'm going to send it over to you and I'm going to bill you for it.